everyone, and welcome back to the MG Matters video series, a part of the Rare Disease Connect in Neurology. I'm Pushpa Narayanaswami, and this is episode 4 of the series. I have with me today Dr. Sophie Lehnerer, an expert in psychological matters and well-being in myasthenia gravis from the Department of Neurology at the Charité in Berlin. And we will be discussing psychological well-being in myasthenia gravis. Dr. Lehnerer, please introduce yourself.
Thank you very much first for the invitation. I'm happy to be here. Yeah, I'm a neurologist, an expert in the neuromuscular field working in Berlin. And we have a certified outpatient myasthenia center here, the largest one in Germany. So we see a lot of MG patients. And my research focuses on the burden of disease, including mental well-being, and also in developing digital solutions to follow along with symptoms of MG and to better the situation of MG patients.
So let's jump right in. I've seen some of your publications on this very important topic. And so I'd like you to first enlighten us about the impact that psychological well-being and mental health comorbidities have on myasthenia gravis and vice versa. We know that most chronic illnesses are associated with difficulty in coping and adaptation. And how is this relevant in myasthenia gravis?
In my experience, the majority of patients rather sooner than later develop a reduced mental well-being, which comes additional to their motor symptoms. And this can manifest itself in very different ways. So for instance, they might just report listlessness or loss of joy, which then is not that easy to distinguish between fatigue. And on the other hand, they might report about anxiety because the MG is bring with itself fluctuations. It's unpredictable. So they never know how will be the next week, the next day, the next month. And they often express a fear then when they really need to talk to a specialist, they do not have one. So they have this constant feeling of anxiety and fear. And I mean, also, especially in patients who have already bulbar symptoms, who have difficulty to swallow or to breathe, they additionally develop panic attacks, which makes it even more difficult. And we know from studies that over 50% of patients who had experienced myasthenic crisis, including mechanical ventilations, they develop a post-traumatic stress disorder.
How about treatments of myasthenia gravis? We always have to consider that. It's long-term treatments. Do you think they have an impact on mental health comorbidities in myasthenia gravis?
Yeah, I mean, when we start to introduce long-term treatments, we talk about long-term side effects, and this can cause fear in some patients. And also, we have to state that some of the medications have an immediate side effect on the mental well-being.
Right. So you're talking about two things. One, a direct side effect of some of the drugs we use on mental health comorbidities or psychological well-being. And secondly, just the anxiety that long-term treatments with potential long-term side effects raise in patients, just that anxiety that they feel. That's great. Thank you very much. You've also worked on the impact of mental health comorbidities on patients' quality of life as well as caregiver burden. Tell us a little bit about that.
Yes, we know that there is a strong negative correlation between the psychological well-being and the quality of life. And this has a personal impact of the patient's life, but also on the family life, on the social life, and also on work. And the caregiver burden is very high because the caregivers first have to see the physical impairment of the patient and have to provide help, but they also have to share the mental state. And myasthenia gravis is very challenging in its own way because it's not visible. There's no visible deficit, and the deficit is also not fixed. So what is possible in the morning might not be possible anymore in the afternoon. And this is for outsiders very hard to understand. And then it's often attributed to the psyche. So it's a loss of motivation that the patients cannot do this anymore. And this is very frustrating for patients. And especially if this comes also from healthcare professionals, that they don't believe the patients, and maybe not from experts, but from other healthcare professionals. And this is very, very frustrating for the patients.
Yeah, and I think you summarized that really well, the degree of burden that a psychological well-being, the lack of psychological well-being or mental health comorbidities pose. Let's shift gears here a little bit and talk about recognizing mental health comorbidities in the setting of myasthenia gravis. How is it challenging both or in both directions, recognizing the mental health comorbidities as well as in the context of treatment or diagnosis of myasthenia gravis?
Yeah, so the first thing is we have to be aware of it and have to ask for it. Ideally, we screen with standardized measures, for instance, the PHQ-2 or 9 or the HADS, the Hospital Anxiety and Depression Scale. We are currently doing a study where we measure the HADS scale continuously with a smartphone application. And it's very interesting to see the course over time. But if a practitioner does not have the time for these standardized measures, which is quite easy because you can give just a question to the patient while waiting in the waiting room. But if not, you should at least ask for it, and then also try to distinguish it. What is MG symptom? So what is fatigue, and what is already psychological illness? And or also, as I mentioned already, with a panic attack, it's a bit hard to distinguish if a patient says he cannot breathe. Is it due to the muscle weakness of ventilatory muscles, or is it because, he develops a panic attack? But it really helps when you do a good analysis and talk to the patient. So mostly I can separate it from MG motor symptoms or psychological well-being.
Sophie, thank you. That was a good summary of how we evaluate patients for mental health comorbidities in the clinical setting. So you mentioned some of the scales that we use. Some of them are quite easy. Most of them, the ones that you mentioned, are very easy to use in clinic. And I often start the conversation before going into the scales by just asking patients, how are you coping? Or are you, direct questions, are you anxious? Are you depressed? Sometimes anxiety and depression may have, funny connotations. Patients don't want to say that they are. So I'll ask them if they are worried, if they are afraid. Those are the terms that I'll sometimes use. So say we've detected that our patient has a mental health comorbidity, their psychological well-being is not great. How then do you manage these patients?
Yes, as you also mentioned, I try to avoid to give them another disorder
Yeah.
comorbidity, but to say that the concerns this patient have, a lot of others share, and this is very common in MG, but we are also able to treat this. So first, psychological help is very important. I already start to say to my patients, seek for psychological help even in the very beginning when they get the diagnosis of the chronic illness with its ups and downs, really to prevent mental health comorbidities. But if we diagnose one, I would definitely recommend one. And then we can also use pharmacological treatment when necessary. There are treatments which do not worsen MG symptoms. This is the fear of some neurologists or practitioners. And then this is why also pharmacological treatment in MG patients is underrepresented. But we can treat it pharmacologically, and psychological help is very important.
Sure, of course. You treat the underlying illness. You also treat the mental health comorbidities that are associated with the illness, but it's also important to independently address the mental health comorbidities. So, what can we as a community do to facilitate the identification, the management of mental health comorbidities and improve psychological well-being in our patients with myasthenia gravis?
I think it's already a big help if we just raise the awareness amongst healthcare practitioners, but also amongst patients and their caregivers. Self-help groups can be a big help for patients, like from patient organizations, or we see also that they seek a lot for help online. And often just a simple question about how are you feeling and how are you coping, and not only about the muscle weakness will help a patient a lot.
Absolutely. Thank you, Sophie. That was a wonderful summary of a lot of information in a very short time. And thank you all for tuning in. And stay tuned for season 2 of the MG Matters video series.